Hi, my name is Dr. Christopher Rapuano, the Chief of the Cornea Service at Wills Eye Institute in Philadelphia, Pennsylvania. I'm here to talk about a practice known as vodka eyeballing. Vodka eyeballing is a relatively new drinking fad. It involves tipping a bottle of vodka or a shot glass filled with vodka and covering your open eye with it. It is for the purpose of getting drunk, or in reality, more drunk. Because as far as I can tell, you need to be pretty drunk to want to put a chemical as strong as vodka in your eye. The theory is that vodka gets into the bloodstream faster through the conjunctival mucous membranes and gets you drunker sooner. That makes no sense to me. The largest mucous membrane is the oral mucous membrane, which is in the mouth, the more traditional method for ingesting alcohol. The surface absorption area of the mouth is many times larger than that of the eye. Occasionally, eye doctors need to remove the surface layer of the cornea to treat certain eye conditions or perform certain eye surgeries. How do we do this? With medical-grade alcohol. This creates a corneal epithelial defect, also known as a corneal abrasion, also known as a scratched cornea. Not only is this extremely painful, but removal of the surface protective layer of the eye significantly increases the risk of an eye infection. Without proper antibiotics and follow-up with your eye doctor, a scratched cornea can lead to poor healing and scarring, and a corneal ulcer often leads to permanent decreased vision from permanent corneal scarring. The alcohol content of vodka varies, but is often around 40 to 50%, that is 80 to 100 proof, but can be up to 75 to 95% pure alcohol. Depending on how strong the chemical, for example the alcohol, there could be damage to cells deeper in the cornea, which could cause temporary or permanent corneal swelling. And that could lead to temporary or permanent decreased vision. Potentially, there could also be damage deeper in the eye, for example of the iris or the lens, possibly leading to cataract or glaucoma. While I have not personally seen a patient after vodka eyeballing, I have taken care of many patients with eye injuries from other chemicals, such as acids and bases. Some injuries are mild and resolve with good vision, while others are devastating, leading to blindness in both eyes. Should you get a chemical into your eye, you should immediately wash it out with clean water. If your eye doesn't feel normal after washing it out, you should see an IMD for an evaluation. We usually treat scratched corneas from chemical injuries with antibiotic drops to prevent infection. To recap, it's a bad idea to put vodka in your eye.